So please go ahead.
Yes. Good morning, all the students of MBA semester 4, and your subject is the community health, and the topic is the community concept of the community health and health for all. So this is a unique topic, and it is very fundamental and basic topic which the student should know. So what is the health? What is the community health? And how to work in a group in the community? And what are the various components of health? So that all will be dealt in this session. So today's our sessions are on the concept of health and community health, then define and discuss the origin of community health, understand the meaning and concept of community health, characteristics of community health, functions of community, and health for all concept. So how it has come and how it is elaborated in the years, in the previous years, and how it will go ahead. So that we will discuss in detail in this session. So the community health. So in this session, it is a holistic approach is maintained, and this presentation is multifaceted in the nature of the community health, encompassing the public health and the evolution of the public health in India. So our focus is on the how the public health, the community health is developed in India, and we will delve into the key concept like determinants and dimensions of health, because unless we understand the health component, we can't understand the community health. So we have to just see that how the disease occurring, what are the highlights of the importance of the holistic approach, how the holistic approach work out in maintaining the health of the people and people's well-being. So basically, the public health replaces the term community health. So earlier the term was the public health, and even in the many countries, the still the public health component is the prevalent, and even the community health, because both the meaning of this public health or the community health is the same. Some countries are using the public health, some countries are using the community health. So in this, in short, the health is an important and common concept, and we must understand health before community health. So we must see what is the health, what factors are involved in the health, what are the various determinants and dimensions of health. So that all has to be discussed before the community health. So, health is not a new concept. Understand, health is very old. Even the primitive people, very ancient people, they are also maintaining their health. Understand, but the focus of the health maybe must have been different. Okay, but in the earlier days, what happened? So, the health is geared up after the 1978, when the International Conference on the Primary Healthcare held in USSR resulted in the Alma-Ata Declaration, which affirmed that the health is the basic human right and it is also a universal goal. So, in that conference, in that gathering, in the which is held in the USSR 1978. That is the first basic step in the modern health. So we can say, and there are a lot of Almata Declaration has happened, and that was decided that health is a basic human right, and every human being should have the a proper appropriate health and health services also. So the meaning of the health is evolved over time. So because it is a changing concept. The health is a changing concept. Firstly, the concept of health mainly focuses on the physical health of the individual. So earlier than the 1977, it was only the physical health. Means if suppose the man is doing everything is well, then it is a physical health. Understand? In 1977, the 30th World Health Assembly decided that the main social target of the government and WHO is health for all. Understand? So in that conference, it was decided. So every human being should enjoy their health in their across their lifespan. So that was decided during that particular conference, and which was very the what you can say the stepping stone of the health in 1978. And simultaneously, WHO also described the health, defined the health. So, according to the WHO, the health is a state of complete physical, mental, and social well being, and not merely the absence of disease or infirmity. Means World Health Organization are also mentioned along with the physical health, mental health, social health, spiritual health, environmental health. Now, this is a new concept which has come in the 21st century, that even the environmental health is also very important, because unless the environment is safe, environment is a very conducive to the health, the human being cannot be a healthy. So the environmental health is also included. But in 1978, it was the physical, mental, and social well-being. Okay. So again, the concept of health is understanding the health is the basis for all healthcare. So we have to understand health, because entire healthcare is based on the healthcare, health services, how the health services are accessible. That all has to be seen when we are talking about the health. Okay. So, and health is different for the different individuals. Understand? For some people, maybe the mental health is very important than the physical health. Somebody may be having the physical health, going to the gym, doing some exercises, yoga, meditation. That might be the important for certain people, because but the entire health is the physical, mental, and social. So it is a holistic approach. It is not a uniform approach. It is a holistic. We have to see, we have to describe the health in the 360-degree angle. So everyone have their own perception of health. So that is the basic concept, because everybody is a different meaning for the individual. Everybody's perception is different, and it will rise to confusion about the concept of health. So because everybody is thinking about in a different fashion, so there might be creating the confusion about the health. So we have to see what is scientifically truth about the health. So the medical professionals like the human body as a machine. So how the medical professional sees the health is, it is like a machine. The disease is the outcome of the breakdown of that machine. So all the medical professionals are seen that the health is very important thing, and it works like a machine. Understand? We have a certain systems in the body, certain organs in the body, and they work independently. Understand? So if there is any variations or any some deficiencies occurs, then that machine is going to be breakdown, and so the doctor will treat that particular organ or particular system or particular functions of the body, and they try to make it that machine work again properly. So even in the medical science, there are many theories are developed by, like Travis has developed that illness and wellness continuum. Understand? There is some another component is the health belief model. So it is all the components of the health or all the diseases are preventable. So in the health belief model and illness wellness continuum, so man can have some alteration in the health, but with the due precautions, with the due medications, with the due changes in the lifestyle, again one can achieve that particular health. So that is the concept of health. And now the illness and the disease. So as per the Almata Declaration, health is a fundamental human right, and it involves the physical, mental, and social well-being. So it is a dynamic concept that is evolved over time. So right from the primitive time to the modern time, the concept of health is changing. So it is moving beyond the mere absence of disease. So earlier view of the maybe the medical profession or the people's perception. So it was a traditional concept, that is a biomedical concept. So it is the absence of disease is a health. So it was very crude concept of the health. So which says that if there is no disease, the person is healthy, but it focuses only on the physical body and its a functioning. It is not, other components are missing in this biomedical concept. When there is an ecological concept, in the ecological concept, it is interaction with the environment, how the human beings are interacted with the environment. So that is more important. And how the even the environment, in which environment so you are working or you are staying, so that is most important. Understand? If you go to the northern states of India, it is very cold in the winter season, and as you go to the south, that not that much important thing is you can see. Understand? So the environment plays a very crucial role in maintaining the health of the people. Then the holistic concept. Holistic concept is a comprehensive concept which includes the physical, mental, emotional, spiritual, and social dimension, including the environmental dimensions. So that is the holistic concept. Well, our entire thing is based on the all the 360-degree maintenance of the health. So we have to see that if we are talking about the health, it should be the physical health, mental health, emotional health, spiritual health, social health, environmental health. And there are various dimensions also. What component is the health? So the physical health, as we have discussed, the physical health, which is the bodily health. It's a body function, strength, ability, and resistance of the diseases. Understand? So your fighting capacity against the diseases, that is the physical health. Social health, how the person or how the individual is socially active, what are the various social support you are getting, and the ability to interact effectively with the others. It involves, even the social health involves some of the psychological things also. For example, communication skill. So how you communicate with the people. If there is any language barrier, you can't communicate. Understand? So social health, it is called as the psychosocial health. Understand? Then the mental health, how your cognitive abilities, how your emotional abilities, how your mental well-being. So that is also important in the dimensions of health. Emotional health, how you regulate your emotions. What is your self-awareness? What are the various ability to express emotions healthily? So that is all about the emotional health. So emotion is also plays very important here in the human body. Then the spiritual health, how this dimension involves the sense of purpose, meaning, and connection to something greater than oneself. So we have to trust somebody. It may be the human being, it may be the God, it may be any religion, it may be any caste. So everybody has got their own trusting things. Understand? Somebody may be happy with the whatever the family background is there, so interaction with the family, the parents, the friends. So that is their spirituality. Somebody says our behavior, how we behave with the other peoples, it should be in a positive manner, in a good manner, the good relationship. So that might be the spiritual health. Spiritual is not equivalent to the religious health. Understand? Religion is different. Spiritual is different. Spiritual means how you behave, how you act, how you trust, how you communicate. So that all includes in the spiritual. So these are the some of the social environment, and again education and access to healthcare influences the health outcomes. Okay, then the physical environment, lifestyle choices, how your lifestyles are there, whether you do exercises, whether you follow the proper diet to take the fruits, vegetables, then how you are keeping away from the all these abused substances like tobaccos, alcohol, etc. So that is all important in the determinants of the health. Even the genetic environment is also played, because how your constitution is made. What are the various inherited traits from your parent, that also determines our health. So it means that what are the various determinants, physical, mental, social, spiritual, environmental, genetic, all plays the important role in the maintaining of the human health. So that is what very important. Then now moving to the community. So now we have seen what constitutes the health, means how the health is maintained, or how the health is what are the components of health in the determinants and dimensions of the health. Now the community. See why we're talking about the health and the community, because these are the going hand in hand, community and community health. Understand? Because our health is not an individual. Understand? It involves the lot of people also where we are staying. Understand? How we are staying in the family. Even in the family also, there are certain peoples. There are parents, siblings, etc. When you go out of the family, there are family friends, there are other peoples, neighbors, etc. And everybody has a certain concept, understand, certain relationship, certain communication. Understand? So community is very important in the maintaining the health. So the word community is derived from the communize, meaning common, public, or shared by all. Understand? If anybody is living in some certain type of villages, so that village or that society, that community is following some cultures, following some traits, following some traditions. Understand? So that is the community. It is a public. Understand? So to whom you are staying. And the term community health has replaced the term public health in many countries. So earlier it was a public health, now it is said as a community health. So why the community is very important? Because see, now we have seen the health. Okay, then see the health in the very primitive time is a different, and now it is a different. Understand? And there are rapid changes in the biomedical and health sciences. Understand? Through the scientific studies, or there are certain advancement in the science and technology. Understand? So there is a new technology, new drugs, new diagnostic, new computerization, and these changes brought great changes in the health science in general and healthcare delivery system of India in specific. So the community health, in a broader sense, it is a group of people living together. Understand? So even the World Health Organization Expert Committee on the Community Health in 1947 in their report agreed on the following definition of the community. A community is a social group determined by the geographical boundaries and or common values and interests. Its members know and interact with each other. It functions within a particular structure and exhibits and creates the certain norms, values, and social institutions. So it is a community is very vast. There are a lot of complex structure involved into that because it involves the values, it involves interest, it involves the geographical boundaries, it involves your habits, it involves your social structure. Understand? So it involves our language, our communication skill. Understand? So it is organized effort. Community is not a individual effort. It is organized effort for maintaining the protecting and promoting the health of the all the people staying in that particular community. Understand? So healthcare and its a delivery system are changing rapidly in order to meet the needs and problems of ever changing society. See, society is always changing. Understand? If you see the primitive society, if you see the in the pre-independent society, post-independent society, new 21st century society, there are a lot of differences. Understand? So, definition given by the WHO expert committee is community health refers to the health status of the members of the community, to the problems affecting their health and to the totality of healthcare provided for the community. It encompasses various factors including physical, mental, social and environmental aspect of health. See again, now we have seen earlier, we have seen the health, determinants of health and dimensions of health are the same. And even in the community also, these dimensions are included. So the community and health, it goes hand in hand. Understand? Those people who are healthy, their community is also healthy. Understand? So it involves a lot of things. It involves a lot of interaction. It involves a lot of components, lot of dimensions. Understand? Therefore, now based on this definition of the community, the modern community's concept of health is different from that of age 19th century. Understand? Health now is a community's concern. Health is not away from the community. It involves the community. Understand? Thus become important in the assuming the responsibility of the health promotion, disease prevention, and rehabilitation. Because if suppose you see health promotion, health prevention, understand? So because see you can just consider you are staying in the family. If the small children are in the family, and there are old age people also in the family, so there is always interaction to the next generation. Understand? See how to maintain the health. What are the good foods? What are the importance of the exercise? What are the importance of the good lifestyle? So that is comes from the community itself. Your habits, your tradition, your customs, that also comes from the community. Understand? So all the facilities and total care for all the members of the community is done in the community itself. Such changes have led to the replacement of the term public health. Understand why? Now you understood why the term the public health is equivalent to the community health. Why they have changed the name of the, understand, it is a community health because health is directly related to the community. Understand? So whatever the activities individually or collectively facilitate the process of prevention of diseases, promotion and protection of the health of all the people. So it is essential to consider the definition, the terms, namely the community and the health. So this definition, the community is also important, health is also important. So that was the main crux of this presentation. You should understand the community. You should understand the health and how to maintain the health in the community. So in the community health, it is a preventive, promotive, rehabilitative aspect are covered in the community health. Understand? So it is a 360-degree. It is a broad scope. So that we must understand. Okay. So now the defining the community and the public health. Understand, a community is a group of people living in a geographical area sharing common beliefs, interests, needs, and organization. They interact with each other. They share common norms, values, and social institutions. Understand? So it is a common geographical area, common beliefs, common habits, common interest, common traditions, common needs, and common organization. Understand? So, this is the community. And on the contrary, public health is a science of protecting and promoting health of the people. In the community also, it is a protecting and improving the health of the people. It focuses on promoting healthy lifestyle, preventing disease, responding to the infectious diseases through organized community effort. So there are many things the common in the community also and in the public health also. Understand? It is the organized community effort. Community is also involved in the public health, and in the community is also involved in the community health. Understand? In the public health, we more focus on the scientific aspect of the health. Scientific rigor is very important in the both the things. So we have to maintain the health by using all the resources, by using all these habits, interests, needs, etc. And but ultimate goal is maintaining the health, promotion of the health, prevention of the diseases. So this is the common element in the community health. Understand? So that we must discuss. Understand? So the community approach, what is the approach of the community? So the community consists of the population. Understand? Community, what it contains? It contains the population, several groups of the people. It may be having the male, female, children, old age people, women, pregnant, postnatal. All the people are of all the ages. Understand? And they stay in a specific geographical area. In the same area they are staying. Understand? Representing various religions, various values, various goals, various beliefs, various interests. So these all includes in this, along with the male, female, old age people, young people, middle aged people. Understands? Even the small newborn children, what not. And the community represents the society by and large. Understand? So, health is not an isolated entity, it is an integral part of the socio-economic, socio-cultural, and political component of total development. Understand? So, it is a comprehensive. Understand? Even it involves if the health is involved, nursing is involved. Like when the health is involved, medical profession is involved. If health is involved, technology is also involved. Understand? So the focus of the community health is improve the health status of the community member. It is only one goal. that is improving the health status of the community member, addressing the health problems and providing comprehensive healthcare services. Understand? So it is a general and comprehensive. And this practice is not limited to the specific age group or diagnosis, addressing health needs of the entire community. Understand? So because see why it is important. See, if you see a primitive man, which was the wandering, hunting, and the community became a sedentary. Understand? And later on, the community becomes a sedentary. Then later on, the urbanization has come up. Understand? So earlier there was the infectious diseases. Now the chronic diseases. Understand? So it is a changing, always changing. In every era, it is a changing. Understand? Now again, it is emerging. Infections are coming up like COVID, like Zika virus, like GBS, Guillain-Barré syndrome. So understand. So there are emerging diseases. Understand? This is going to happen because we cannot predict 100% health of the people because there might be alteration in the health. Understand? But with the help of various medical profession, nursing profession, technology profession, diagnostics, imaging science, we have to see that how that individual person can be helpful or can be given some access to the health and they can maintain the health of the people. Understand? So that is the community's the comprehensive approach. So what it includes, the community health refers to the health status and well-being of the specific group of people living within the definite geographical area. So it is art and science of taking care of health in all aspects of life, which includes promotion and preservation of health and prevention of diseases. So what we have to see as a community health professional, what we have to see, we have to see that it is a good sanitation, good water supply, health education, self-care, nutrition education, controlling communicable and non-communicable diseases, understand, organizing proper medical and nursing services, improving standard of living. So this all includes in the community health. It is not in a uniform direction. It is from the multiple directions. We have to see the environment. If it is environment, then we have to see the water, we have to see the sanitation, we have to see the hygiene. Understand? So there are a lot of things in the health of the community. Understand? So it is a primary prevention, secondary prevention, tertiary prevention. Understand? That all has to be applicable to the community. Understand? And by application of the various level of the preventive strategies, we have to maintain the proper health of the people. It might be the physical health, mental health, social health, spiritual health, environmental health. We have to see the standard of living of the people, which should be in a proper manner. Understand? So one should not have any of the diseases, any of the very adverse habits like tobacco and alcohol and drug. Um, there are a lot of things are there. Understand? So in the community health includes various discipline. So how we can see we can help to the individual, to the epidemiology, through the biostatistics, environmental health policy, behavioral science to address health issues at the population level. So we have to utilize even the agriculture sector, agriculture, what we have to cultivate in the farms, which is the very important component for the sake of the good health. So that also we have to see. So it is a multi-dimensional, multi-sectoral approach, we can say. The community's approach is a multi-sectoral approach, multi-dimensional approach, multifactorial approach, so that all have to be managed while the looking after the health of the people. So what are the aims of the community health? So there are only 2 to 3 aims. One is the health promotion, disease prevention, and management of the factors affecting the health. So we have to focus on the collective health of the individual. It is a 360 degrees approach should be there on the families, populations, rather than the just individual health. So it involves the collaboration among the stakeholders, including healthcare providers, government agencies, community organizations, and residents. Okay, it involves various other factors, sectors also, even the agriculture sector, IT sector, understand? So medical, nursing, technology, understand? Government agencies, political agencies, understand? So all the agencies are working for the three aims. One is the health promotion of the people, disease prevention of the people, and management of the factors affecting health. Understand? Even if you go to the developed countries like Denmark or the Korea or the US, UK, so because their health of the individual is a priority, so even they sees that the cleanliness of the environment, road conditions, understand? So that all have to see, understand? So environment has to be seen, environment has to be protected, so that all is important. So in the maintaining the health of the people. So the sociologist Hillary in 1995 determined the 4 common components of the community. Understand? So which are these 4 components? So these are the people. People are very important component of the community who give the identity to a particular community. Understand? So the people are very important in the community. So people help. People should be accessible to all the services. Understand? And there should be a common goal. Community has some common goal and needs by which people seek and get health services and fulfill other needs. Understand this? So there should be a common goal. There should be a place. The place is a geographical location. So already in the definition we have discussed, this a community is a in the geographical boundaries, geographical location are certain aspect of the community. Community is more than just a place. Just physically living in specific area does not make you part of the community. So it doesn't mean only in the living in that particular area for temporary, for certain period. It's not a community. You should be residing in that particular community for longer time. Truly being a community, a geographical location also needs social interaction as well as common ties to live there. It's not only in the geographical, living in the geographical location. We have to interact with the people, interact with the society, interact with the various stakeholders. Understand? So, and how you interact is most important. Then there is a social interaction. Social interaction can come in many forms, from visiting and interacting with the neighbors who organize events. Common ties can include attempts such as schools and sports, as well as the social and environmental issues. So we have to see that there is a social interaction. Though you are staying in the certain geographical area, but and if you are staying and not communicating, so that doesn't become a member of the community. Understand? You have to have the relationship with the neighbors, with that particular geographical area, those who are staying. Understand? And we have to take part in the event, maybe the religious events or some friendly event, some social gatherings, you have to interact with the people, then only you will say as the member of the community health. And that is the various component. And if your communication with them is a proper, your social health will improve, your psychological health will improve, and you will become a very healthy person in the life. Understand? Then the characteristics of community. So what are the various qualities of the community? It is a sense of togetherness. See, healthy community, unhealthy community. If you wanted to build a healthy community, there should be sense of togetherness. So whatever the people are saying, see, you have to think that everybody is important in the society. Every individual is important in the society. How I have got some privileges, other people also have got some privileges. Understand? So it is a community signifies a group of people in which the people do not take part in a particular interest. On the other hand, they share the basic condition of the common life. Understand? So they share the basic condition. Understand? They share their ideas, their concept, their philosophies, and they see that there is a sense of togetherness. Then there is a definite of the locality. So the locality, see, there might be what you can say, you are staying in the extreme in the hilly areas. Understand? So how your locality is there. So locality is the physical basis of the community where you are staying, whether you are staying in the hills, whether you are staying in the plain land, or whether you are staying in the extreme villages where there is a one family and after 2 to 3 kilometers is another family. So that is the definitive locality. Group of people forms a community only when they begin to reside in a definite locality. So the peoples are staying for longer time in that particular area. So they becomes a acclimatized with that particular locality, with that particular type of people. Understand? So they can maintain the sense of belongingness and feeling of community. So after staying the long time, interacting with them, sharing with them, understand? So the community sentiment is very essence of the communities. Understand? Community sentiments, how you are sensitized with the community people. The community exhibits a strong sense of belongingness and feeling of in my village or my city is a natural expression of the such community. And then there is a certain responsibilities also. Being a member of the community, you have got certain responsibilities. You have to behave in a proper way. You have to act like a what you can say the citizen of that particular country, that particular state. So that we have to see the predominance of the primary relations. Understand? The community is often regarded as a primary group, and it is characterized by the predominance of personal and relatively durable relationship. There is a comparative simplicity and sincerity of in a human relationship and homogeneity. So the primary relations is a primary group. Primary group is the group which is there inside the family member. Maybe our sibling, our parent, this becomes a primary group. Understand? And if suppose your relationship with the primary members, if it is good, then even the secondary groups also becomes a good. Understand? It is characterized by the personal and relatively durable relationship. Understand? And it is what you can say the mandatory relationship. Understand? The parents or sibling, we can't change. Understand? So it becomes a predominance of the personal and relatively a durable relationship, and there is a comparative simplicity and sincerity in a human relationship and homogeneity. Understand? So there is a equal type of people, equal characteristics of the people. Understand? So there is a certain social norms. Understand? We have to accept that norms. For example, it is a one person can marry only once. It is the rule and regulation of that society. We cannot go beyond that. Understand? So certain times the children should behave in a certain manner. Understand? So behavioral problem will be treated as an abnormal social relationship. Understand? Behavioral problem like a theft or like a lying. Understand? So certain times these are the various values of that particular society, that particular community. So that has to be there. So if suppose if that particular social relationship or whatever the social behavior, if it is maintained properly in that particular community, then it is said that this is a community, this is an ideal community, this is a healthy community. Understand? And again, the homogeneity. Homogeneity is the population, another important feature of communities where the people will exhibit the similarities in their dress, in their speech beliefs, values, attitudes, and behavior. Understand? If suppose if you behave in an odd manner, the people will laugh at you, people will insult you. Understand? So we have to remain in the society that you have to maintain the homogeneity. Understand? So then variation you can variate whatever the things you wanted to do in the dress, in the speeches. Understand? But the basic thing is the communication skill, values, attitudes, behaviors are the common. Understand? There are certain flexibility in that, and that is acceptable. Understand? So that we have to see. So these are the some of the characteristics of the community. Then how what are the various functions of the community? How these functions are in line with the maintaining the health of the people. Understand? So we have to function it properly. We have to interact with each other. Understand? So how we should behave. Understand? The community provides services to the member. So there might be in a good society, of course, there are certain libraries they are providing. There are playground they are providing. Understand? There are religious places society is providing. Understand? The common platform they are providing. Understand? So these all are the services of the members where they grow, where they learn many things. Understand? They maintain their health also, because there is because health is not only the physical health, it is mental health, social health, spiritual health, that all will be maintained through this access to the services. Understand? The community provides space for housing and shelter for socialization. See, it is the responsibility of that particular community. So to have the space for housing and shelter, understand, for socialization, particularly for the children, how the children are socializing. Unless they react with the other members, their social health will not be improved. Understand? So it provides the skills and resources necessary for the community. Understand? It is a language skills. Understand? Some manual skills. Particularly in the community, there are lot of skilled people are there, like a carpenter, like a plumber, like tailor, etc. Understand? So we have to learn from each other the various skills. Understand? So even in the secondary group, like schools, colleges, vocational centers, they are also a social organizations, and they also provide the skills for the community people. It also provides the safety and security by protecting its members. So that is the basic need of the people. That safety, security, physiological needs. So these all are very important. So there is an opportunity for interaction between its members. So there should be the interaction with the members. Understand? It maintains the community to standard that can be used by all the members. We have to maintain the standard. We have to see we are maintaining the quality. Understand? So safety, security, there should not be any harm to the people. Understand? So that all quality has to be maintained, and it balances the needs of the members with the needs of the community. Understand? So it is the members and the needs of the community. So whatever the needs are there, understand, for the child, so it is a need for the socialization. For the adolescent, there is need to acquire some skills. That is also important. Understand? In adulthood, there is need for the vocation, need for the finance, need for the economic development. Understand? So these all are the needs of the community people. And as a community, as a society, we have to provide all these things to the people. And how, what are the principles of it? So there are certain rules and regulations to be maintained in the community. So healthcare should be shaped around the life pattern of the population. So healthcare is a part and parcel of each and every activity. It should serve and should meet the needs of the community. So health needs of the community has to be means what are the health needs? There might be a proper water supply, proper sanitation, proper playground, proper exercise places. So these all are the needs of the community, and which is related to the health. Proper nutrition, it is related to the health. Understand? So if suppose these needs are fulfilled, the man can enjoy their health. And the primary health care should be an integral part of the national health system. So primary health care should be there. So every community, every population, understand. So that has to be covered. Like in the villages, there are sub centers, there are primary health centers, there are secondary health centers, there are tertiary health centers, which caters the health services to the people. Understand? And it is a responsibility of the government to provide the health services which are accessible, which are affordable, and according to the needs of the people. So these are the some of the principles of the community health. Understand? And the health organization at all levels should be designed in the support of the needs of the peripheral level. So health organization, whatever is there, primary health center, sub center, or some laboratory services, or even the private clinics, private hospitals, these are all health organizations, irrespective of their financial status. Understand? So they should design to support the needs of the people, especially related to the technical supply, supervisory and referral agencies. Understand? If suppose if there is no services of that particular stature, then we have to use the referral agencies. We have to send the patients to the higher centers. Okay, and healthcare activity should be fully integrated with the activities of other sectors involved in the community, like agriculture, education, public works, housing, communication. This whole sector has to be worked towards the health of the people. Understand? Even the agriculturists should produce the things which are important for the people. Understand? Like fruits and vegetables, those who are prevalent in that particular area, what we can say the seasonal fruits, seasonal vegetables, seasonal grains. So that has got a more value. Understand? So even the education should be given for looking into the level of that particular areas. Understand? If suppose if we are opening the medical colleges in the rural areas, and there is no primary and secondary education in that particular area, there is no use. Understand? So we have to see that right from the beginning, that pre-primary, primary, secondary, all education sector is there. And then further we can improve the education sector. Public works, housing and communication, etc. has to be seen there. So these are some of the principles of the community health. Okay, and the total local population should be actively involved in the formulation and implementation of healthcare. See, in the healthcare services and the healthcare activities which are there at the village level or at the community level, so the people should be involved in that. For what purpose? So then we can identify the needs of the people, identify the priorities of the people. Decisions upon the local needs requiring solution should be based on the continuing dialogue between the people and the services. Understand? So the healthcare offered should place a maximum reliance on available community resources and should remain within the cost limitations relevant to each country. So that also has to be there. Healthcare should be provided place maximum reliance, reliable on available community resources. So how that can be used, that also we have to just see that, and we have to see that even the cost limitation and relevant to each country. Okay, so the healthcare should be an integral approach of preventive, promotive, curative, and rehabilitative services. Understand? So whatever the health services are there in the community, so it should be serve the preventive also, promotive also, curative also, and rehabilitative services also for individual, families, and community. Because community is not only the individual. It includes the family, it includes the surrounding area, it includes the surrounding people, and balance between these services would vary according to the community needs and might well change over time. So that has to be there. So how that public health or the community health in India is evolved, understand? So Dean Edward McGovern of the University of North Carolina in 1956 clearly described some of the areas post-Vedic period, so that is 700 BC, where the medicine and public health were prevalent during this period. The first doctor was the first man and first nurse was the first woman. This was the concept in the primitive area. And Ayurvedic medicine was introduced by Atreya, Charak, and Shushruth. So Ayurvedic medicine and Tridosha theory was introduced in this area. Then comes the empirical health area where the symptom-centered health was there. Behavioral science was ignored in this era. Okay, then the basics science era where some of the technology came into the picture, that like a thermometer, BP apparatus, microscope were introduced, and homeopathy was practiced in this era in many countries. Okay, then comes in 1900, 20th century, that is a clinical science era, where the behavioral health was introduced. Great sanitary awakening started in this era. Public health science era, birth of the public health took place in England. Many epidemics took place and the rise of epidemiology. Understand? So in this era, that epidemiology has come into the picture. Then the political health science era, the health for all by 2000 AD was introduced, and greater importance was placed on the physical, emotional, political factor that were considered for the health. It means, see, when the earlier year, primitive year, the Stone Age, we can say, at that time, the people used to eat the raw foods, understand, and the raw meat and all, understand. So the people thought there is no, and people were wandering, they're roaming here and there. There is no place. But slowly, they become the socialized. They become a societal. They become a community oriented. So they started living together. Well, there is a relationship. Then the language come into the picture. Understand? The people tried a scientific way. Understand? So in this empirical health era, basic science era, clinical science era, so like this development took place in the public health. Understand? And today now the entire civilization, entire civic infrastructure has developed as per the advanced technology, advanced science, advanced need of the people, understand? And the health is now become a very comprehensive approach, or you can say that it is a holistic approach. Health has to be lived. So the public health is developed and community health is developed in this directions. Understand? So here also the British period was there, 18th century. The British established the military services, control of India, the administration, leading to increased morbidity and mortality. Understand? So as the people are urbanized, as peoples are away from this nature, environment, so that there is started the morbidity and mortality. Understand? So public health infrastructure also improved in this era. Now it is some Indian research association found out. Now it is ICMR which started the thinking about the something new, something innovative, something. For example, if suppose if anything goes wrong in particular area, understand. So now, particularly, I wanted to give here one example that in the Vidarbha and Marathwada region, there are certain villages where there is a people's hairs are losing. So the ICMR came into the active phase, and they sent scientists to study that particular epidemiology, and they came out with the proper solution for that. Understand? So like this, the science and technology came into the picture, and the people's the problem will be solved by the science and technology. Understand? All the researches are conducted, are the society oriented, the people oriented, societal relevance. Understand? So there is a certain impact on the social life of the people. So then it is a helpful for all the things. So in the primitive medicine, the prehistoric man, motivated by the feelings of sympathy and kindness, is always the best of this kindred. Understand? The concept of disease in which the ancient man believed or the supernatural theory. Then he practiced appeasing course by the prayers, rituals, and sacrifices. And there is also evidence that prehistoric man improvised stone and flint instrument with which he performed the circumcision, amputation. See, these are the old primitive medicine. What was there at that time, and what is the today? Understand? The primitive man using the stone and flint for the doing some operation, but now there are very advanced technology. There is robotic surgery, there are laser surgery, which has made very fantastic improvement in the health sciences and in the health of the people. Means whatever the science and technology came into the picture, it should be used for the welfare of the people. Understand? And that's what very important in the community health. And in India also, one may still hear a talk of curing snake bite by the mantras. Disease like leprosy are interpreted as being punishment. You still there are certain things still prevalent, like in the rural or tribal areas, certain practices which are not scientific are still practiced. The traditional healers are still found out in the parts of the India. So they live close to the people, and their treatments are based on the various combination of religion, magic, and empiricism. Understand? So for that matter, only in 2005, Indian government has launched the Ayush Ministry, because otherwise also the people are trying to get the health services from the traditional healers like homeopathy, Ayurvedic, naturopathy, some Siddha system. There are a lot of systems are there. Understand? So it has become a now the government protection for them, and people are having the privileges, and it depends upon the need of the people, need of the society, need of the community. So that all actions are taken by the government will be it will become a needs of the people, and which is solving the problem of the people. Even the Indian system, Ayurveda, Siddha system practiced throughout in India, Siddha system practiced in Tamil speaking areas. Ayurveda is knowledge of life, where the life may be prolonged by the Ayurveda. according to the some authorities, medical knowledge in the Atharvaveda gradually develop into science of Ayurveda. So that is also one of the thing which is very important. Understand? So Indian system of medicine, including Unani, Siddha, homeopathy, are very much alive in India even today. In fact, they have become part of the Indian culture. They continue to be an important source of medical relief to the rural population. So in this way, see how the community is developing. So that what the intention of putting all this information of all the systems of the medicine, all the system, which is very important to improve the health of the people. Understand? So whatever the things, see, it is not in a one direction. It is from the multiple directions. We are helping the people in the multiple direction. It may be from the government sector, it may be from the private sector, it may be from the agriculture sector, it may be from the technology sector. So all the people, all the stakeholder which are helpful in the improving health of the people. Understand? Even some of the medicine, that is the Chinese medicine, or the modern medicine, or the Ayurvedic medicine, or the homeopathic medicine, all for what purpose? They are all focusing on the health of the people. Hygiene, dietetics, hydrotherapy, massage, drugs, all were used for the welfare of the people, doing the health, good health to the people. So that's important thing is that. So now we are coming to the health for all. See, in my earlier slides, I said that there is a global strategy because in 1978 Alma-Ata Declaration in USSR. So that is health for all, and so their health for all by 2008 because in 1978 that was declared by the USSR, and the entire World Health Assembly was part of that particular conference. And they said that health for all by 2008. It doesn't mean health for all means everybody will be healthy. No, it is access to the health should be there. All the people should have the access to the health. All they should have the affordable health services. All the people should have the health services which are need based. So in that the broad vision of the primary healthcare approach was endorsed by the all member state of the World Health Organization. And the primary healthcare concept was introduced in that particular conferences. And development of a nation depends primarily on its capacity to mobilize its natural and human resources. The India has a vast pool of human resources, and by utilizing these resources, we have to assure the health of the common man and all related. So that is the most important thing. Understand? So the development of the nation is most important. See, that is now the higher level of thinking in relation to the health of the people. Understand? So nation is also important. If the nation's economic growth is improved, then even the people's growth is also improved. Understand? So it will improve the health, human resources, utilizing resources. So that in that way, it is a holistic approach to the health services to the people. So if you see the developed countries, understand, and comparison to the developing countries, all determinants of good health, adequate income, nutrition, education, sanitation, safe drinking water, and comprehensive health care. So these are the some of the things which are very important in the relation to the health services of the people. So in the contrast, only 10 to 20% of the population in the developing countries enjoy ready access to the health services. So like this, in the developed countries, we have a lot of extra modern facilities. So in the developing, little bit services are not that much standardized or that much what you can say the extra or ultra modern facilities may not be there in the developing countries. As we grow towards the rural or tribal area, so again these services are also diluted for the people. So if the economic growth is happened in any country, then definitely the entire health of the people will be improved. So the large number of people, perhaps more than half, have no access to the healthcare in the developing countries. But in the developed countries, the 100% people are enjoying the health and enjoying all the privileges which are there in the civilized society. So that is what it is there. Against this background, in 1981, the members who placed themselves ambitious target to provide health for all by year 2000, that attainment of the level that health will permit all the people to lead socially, economically productive life. So the people has to enjoy a socially and economically productive life, which was the basis of the that USSR conference, and all the member countries have adopted that primary healthcare approach. Understand? So every country, even in India, there are more than 25,000 primary health centers and 122,000 sub centers are developed in India to cater the services. Earlier it was not there, but as we progress economically, progress in the socially, we have launched a lot of medical services, and there are a lot of funds utilized for the science and technology, where the people's health and people's other facilities are taken care for this health services. So the immediate relevance is the minimum all the people in all the countries should have at least such a level of health that are capable of working productively and participating actively in the social life of the community in which they live. So overall objectives, overall purposes, overall the quality of the community health should be the people focused. So every person on this in this universe should enjoy a very productive health and participating actively in the social life. So that was the main aim of that particular health services. So health for all means health is to be brought within the reach of everyone in a given society. So in the 1978 declaration, they made the health for all, but it means that the health services within the reach to the every community members. And it implies the removal of the obstacles of the health, means whatever the obstacles, whatever the hurdles which are there for the getting the health services, that has to be taken care. And elimination of malnutrition, elimination of the ignorance, elimination of the diseases, contaminated water supply, and unhygienic housing has to be taken care in the course of the time. So that if that happens, if suppose all the peoples are well nourished, the ignorance is removed, no diseases, pure water supply, and hygienic housing, etc., then people may enjoy a highest standard of the health services. It depends upon the continued progress in the medicine and public health. So when it will happen, when there is a progress, when the science and technology comes into a picture, and all this science and technology comes together and they work for the people. So at that time, it will have a proper impact of the this medicine and public health on the health of the people. So it was a holistic concept. See, this entire presentation is based on the holistic concept of the health, calling for efforts, industry, education, housing, communications, and the public health. So these all sectors will come into the picture, and they will help these help the people to solve their health problems. And attainment of health by 2080 was a central issue of an official target of WHO. understand, and it's a member country. So it is symbolized the determination of the countries of the world to provide an acceptable health of the all the people. And health for all has been described as a revolutionary concept and historic movement, a movement in terms of its evolutionary process. So health should be the basic agenda to solve the problems of the all the people. So there are the key takeaways and next step. Community health is a complex and multifaceted concept. So requiring the holistic approach that considers all the dimensions of health and the various determinants that influence the well-being. By understanding this concept, we can work together to create healthier communities and improve the lives of all individuals. Understand? So the community health concept is a very, very, very vast concept. It is a multifaceted, multi-sectorial, multi-dimensional sectors. Understand? Right from the prevention, of rehabilitation, curation, etc. All the components are there. And so the people are important. In the community health, the people are important. So it should be like this. It should be the by the people and for the people. So community people only have to work for their health. Nobody else will work for them. Understand? So, but you can take the help from the government sector, the private sector, education sector, agriculture sector, and it is also I can quote here that there is the government or the federal government is also the very important component in this. So, and even the country by and large is also important because as the country grows economically, socially, understand, so the people also will grow along with them. So that is most important thing is there. So when we'll conclude the session that a continuous investment in the public health infrastructure, promoting healthy lifestyle, addressing the health disparities is very important. So always the science, technology should come into the picture, agriculture should come into the picture, government sector come into the picture. There should be collaboration between healthcare professional, community members, and policymaker, which is essential to achieve the lasting and positive change in the community people. So these are the some of the things which are very important in this session. So we have learned that the holistic approach of the community health means it is not only the community, it is the community plus health is equal to community health. So the in the community there are people of various ages, various statures are working together, living together. They are sharing the common interest, common beliefs, common tradition, common customs, understand common habits, understand common geographical area. So these are the community. So though they are working in the same geographical area, and along with the in that the health services which are provided by the government or the private sector has to be great use of that. We should be avoid all the adverse things which are there in the community. We have to avoid, and we should work for the health of the people. Everybody should work for the health of the people, and we should make our community, our society a very strong and healthy. Thank you so much.